and welcome to this advanced tutorial on Google's Notebook LM for doctors and medical professionals. It shares with us today 7 use cases that we can use in our practice to help analyze research, read research, critique resources, and to create content for patients and for colleagues. I hope you find it useful. If you do, like it and share it. And we're just going to get started now. Okay, so I am going to load up Notebook LM. And my first use case is going to be, instead of reading a research paper, I'm going to create and listen to a podcast specifically designed to provide an in-depth analysis of it. I do that by finding my research paper. This is the Delhi agreement back in 2014-15 on groin pain. And as you can see, I've got the sources on the left, chat in the middle, studio on the right. And if I maximize my screen, you can see the sources on the left, chat in the middle, and studio on the right. To create the podcast, I'm not just going to press generate, but I'm going to click on customize here. And I'm going to write tailor this towards physiotherapy practice. And let's have a listen to the first
Hey everyone,
part
and welcome
of this.
back for another deep dive. Today we are going to be tackling a topic that I know a lot of you have been requesting. And it's something that is near and dear to my heart as well. Because, well, I've been there personally. And it's something that every athlete wants to avoid, but something that almost every athlete experiences at some point. And that is groin pain.
Yeah.
So groin pain, it can be really tough to figure out what's actually going on, what's causing it.
Yeah, absolutely. I mean, think about it this way. The groin, it's kind of like this crossroads, right? You've got all these muscles and tendons and ligaments all sort of packed in there, right next to the hip joint, which is already a pretty complex structure on its own.
Yeah.
So when an athlete comes in and says, hey, my groin hurts, well, it can be really tough to know exactly where to start. You know what I mean?
Right, like where's the starting point?
Yeah.
Is it the muscle? Is it the joint?
Is it the hip? Is it the...
Exactly.
something else?
And then on top of that, you've got all this confusion with the terminology.
Oh, tell me.
So yeah, 20 more minutes of that podcast to really help you get a good understanding of the paper. The next use case, instead of reading multiple research papers on a topic, I'm going to create and listen to a podcast specifically designed to provide an in-depth analysis of them. So I'm going to click Create New. I'm going to choose some files, and these are all files by on research papers by Jill Cook on tendon pain. They include Achilles tendon papers and the seminal work on the tendon pathology. One of the papers is called Sex Differences in Tendon Health, so it's pulled that out as a title. And yeah, what I'm going to do is, when it's ready, is click on Customize, and I'm going to insert. Okay, so using all sources, give me an overview, make it interesting, and tailor it towards me as a physiotherapist. Okay, let's have a listen.
All right, everyone, welcome back for another deep dive with us.
Yeah.
You know those things you see every day as a physio? Achilles tendons. Well, get ready, because we're about to unpack some serious tendon talk today.
And this is going to be super relevant to you, especially when you're trying to figure out what those imaging results actually mean. You know when you're looking at them, and then you have to explain them to your patients.
Exactly. So we've got 2 really fascinating sources for this deep dive. First up, we've got a systematic review with a meta-analysis, which basically means it looked at a ton of studies.
So it does also talk about the other papers in there. It just mentioned 2, but during the rest of the talk, it will mention the others as well. I'm going to head back to the notebook home for the third use case, which is I'm going to be delving deeper into a specific topic by exploring the multiple research papers and critically analysing their findings to develop new insights and a more comprehensive understanding. So I'm going to do that by going back into my tendon pain papers, and I'm going to use the chat function and the notes here. To do that, I've created a series of questions that I'm going to put into this chat function. Think of the chat function as you having a research assistant. A research assistant that's read all the papers in detail can memorize every single part of it, and when you ask them questions on it, they're going to give you those specific structured information and answers. Before we start, there are a toggle up here. You can make it longer or shorter, some of the answers, if you choose to do so. I'm just going to leave it on the default, and let's get started. Question 1. Give me 5 takeaway features for managing tendon pain for physiotherapists. And here is my answer. Question 2. What type of strengthening exercises should be used, and is it okay for pain to be present? And here is that. Question 3. What use can stretching be in tendon rehab according to these sources? And there is that answer. Question 4. Do these sources mention much about advising ice to patients? Question 5. According to these sources, what is the difference between stiffness and elasticity in a tendon? Okay. Next question. I'm writing a small presentation on tendon pathology and rehab and its relation to Jill Cook's work. What key features should I talk about? Lots of information there. What future research topics do they discuss? There we go. And finally, what's the quality of these research papers and can I trust them? And there we go. So just like a chat with a research assistant, you're not going to have further access to those answers unless you somehow save it as a note. That's what we're going to do here. We'll scroll to the top and save them all as notes. That moves it into this right-hand section down here in the notes section, and it will also give it a title as well. There we go. The notes section also has a few other specific default things that you can select, and some of these are very useful if you really do need to have a good understanding of the topic. I'm going to head back into the home now, and I'm going to create a new use. So what I'm going to do slightly differently is I'm now going to examine a collection of research papers on a broader topic with diverse theories, with the goal of analysing the differences between the theories and trace their evolution over time. So to do that, I have a selection of research papers on scapular stability, and I'm going to load them into the software. So they're loading in now, and I'm just going to again use the chat function, and I've just got a couple of questions that I'm going to ask. First one is, please analyse the different theories and views on scapular stability and its role in shoulder function and pain, and emphasise their differences. And there we go. And then secondly, how have these papers' various theories and ideas changed and evolved and developed from 2000 to the latest paper? And there we go. Super. And again, I'm going to save those to my notes. Back to the home page again. For use case 5, I'm going to be creating nuanced podcasts on specific topics that emerged during my research to solidify my learning. So I'm going to go back into my tendon health papers, and when I was creating my notes, there was something that maybe piqued my interest, and I want to create a podcast on that. So strengthening exercises for tendinopathy, for example, is very interesting, and it had some fairly decent detail. And what I'm going to do here is then go to that note, and I'm going to convert it to source. That's going to move it over here to this left-hand side, and I can now create a podcast on it. Now, the software is a little bit buggy. Sometimes you can click customize and say, just create me a podcast on this particular source. But to be on the safe side, in my experience, what I'm going to do is be removing these sources. So let's do that now. I'm going to customize, and I'm going to say tailor this towards physiotherapy practice, and click generate. Okay, and here
All
is
right,
that.
so today we're going to take a deep dive into something I think pretty much every physio out there has to deal with at some point.
Oh, yeah.
Tendinopathy.
Absolutely.
You know, it's one of those things, right? The patient walks in and they are frustrated.
Yeah.
They've had this tendon pain that just won't quit.
Mm-hmm.
And, you know, we've got a whole stack of research here
Yeah.
all about the latest thinking when it comes to strengthening exercises
Right.
for those tendinopathy cases.
I'm ready.
So get ready, folks.
Yeah.
You might need to rethink a few things.
I think.
Okay. Now, topic 6, case use 6 is going to be very interesting. I'm going to be creating and making resources for patients by transforming some complex research findings into interesting and insightful podcasts that I can share with them to help empower them and educate them on their journey. Now, I'm going to use an example of returning to sport following a total hip replacement. So I've gathered some research papers, and what I need to do is create some specific kind of notes on certain aspects of it. So what I'm going to do here, you'll see, is I'm going to ask it about what does this research state about returning to running, and discuss timeframes and important notes that the findings suggest. And it will give me lots of information. I'm also going to ask it another question. What does the research say about returning to cycling, and discuss the timeframes and important notes that the findings suggest? So with these answers, this, you know, it's different patients have different kind of goals. So with running, for example, I need to save it to note. And what I'm going to do is also do the cycling one as well. But with the running one, the running one here, I'm going to convert that to a source. And exactly with the other one, I'm going to remove the other original research papers from the sources so that the podcast specifically talks about running with the prompt, create an engaging podcast for a patient to understand the findings. Okay,
Hey, everyone. Welcome to a deep dive all about getting back to running, but this time it's after a hip replacement.
You got it. We've got tons of research to help you get back out there, but we want to make sure you're doing it the right way.
Exactly. Safe and successful, that's the goal. We're looking...
Okay, now I'm going to talk to you about 2 methods on how to share it with the patient. First is here, so you can press on the Share Audio Overview. You can click on this and then copy share link. Press Open at the bottom. And then what you can do is copy share link, head back, click on Add Note, and then here right click paste, and there is a link that you can share with your patient. Now, just to be aware though that if you delete this now and let's say create one about cycling, then they won't have access to it anymore. So if you wanted to create one about cycling, you will need to go back into the home of the notebooks and add in the 3 research papers, add that question that I asked earlier about cycling, and then create a podcast on that, which will create you a new link. Another way of doing it is to click on download. And if you click on download, it will save it as a WAV file. What you can do with that WAV file is upload it into Google Drive, for example, where you can share it in there and have it to open to anyone with a link, and you can share that link with a patient or a colleague. And moving on to the final use case, which is a very interesting and important one. I'm going to do that by going into the scapular stabilization work. And what we're going to do is we're going to critique existing resources, such as an online resource, such as a website, or we can use some patient information leaflets that we upload, and we can compare the information that's on that resource against the findings of research papers. So I'm going to use the scapular stabilization papers. And what I'm going to do here is add a source for a website. Now what I'm going to do here is head over to Scapular Dyskinesia, hosted on the Physiopedia website. Now I've got nothing against the Physiopedia website, it's an excellent resource. But what I'm going to do is right click and copy, head back into here and go to website, and I'm going to control and paste it and press insert. And that here is then going to add into the source, and the AI system is going to read it. And what I'm going to do here is in the chat, I'm going to add a question. And that question is, I've included the website source. Which of the journal papers sources do the website align with the most, and could it be more up to date from the information gathered from the more recent journals? And how could it be improved upon? Okay, and yeah, it will give me lots of information on what the website is like, and yeah, a summary at the bottom by talking about how it could be more up to date, for example. Okay, so an excellent way of reviewing some of your own resources, or if you happen to be sharing resources with students and colleagues and you just want to have a quick look and see, how actually good is it? Well, you can use this to find out. And that is 7 different use cases for using Notebook LM for doctors and medical professionals to help us with our research, our learning, and our critiquing of resources available on the internet. Thank you very much.